That's good. Nice to see you.
Yeah. Oh, yeah. We met.
Yes, we were just talking with Phoebe. I think it's been maybe 20 years since George's back surgery, and I think my mom's back surgery was maybe just right after that. So it's probably been, 18 years or something since she was seen by you. So time
Oh
flies.
my gosh.
I know.
Time does fly. So much has changed.
I know.
And I forgot, how does she pronounce her name? Is it Wardy?
But yes, that's actually how you pronounce it.
Okay, yeah. Yeah. I remember that name. Boy, you could no amount of time could make you forget that one.
It's different, that's for sure.
Yeah. Well, and she's now 96.
She's 96. Yes.
Okay. And I understand that a CT scan recently showed she has a brain tumor, and that's the concern today.
Yes. Um, there's so many questions. She's done really well. I mean, she has Alzheimer's, but it's a
Mm,
very slow progressing kind. I mean, she was diagnosed in 2011, so it's really been slow, kind of downhill. But she's done pretty well, and physically, she's actually done really well. But
mm,
but over the last year, I think she's fallen 3 times, and so I'm wondering, for one thing, could the falls cause what the tumor, or is the tumor maybe what's causing some imbalance and having to do with the falls, and not just falling from imbalance, because this last time, I mean, she was basically on the toilet, and then
mm.
passed out and fell over. So I'm wondering what the relationship is there. And then, what they said in this report is they think it's a meningioma. And
Mhm.
I don't know if that's the same. Her sister had brain tumors. And I recall that the doctor had said, especially when she got up into her 80s, that they're very slow growing. And like, then why'd you do anything? You know what I mean? But I don't know for sure if that's this. And how do you determine if it's something cancerous? I mean, we just don't know what the right next steps are.
Right. Okay. Yeah, those are certainly understandable questions under these circumstances, and we can definitely go over them. Can I ask a few clarifying questions?
Please.
Does Wardy live by herself, or does she live with care right now?
She lives in a group home. There's 10
Okay.
elderly people and a family and some workers that take care of them.
And you and your husband are obviously looking out for her as family. Are there other family members in the area?
No one's in the area. Mom's still in the valley, and we relocated to Payson. And so
Okay.
and my brother lives up closer to Show Low. So there's no one in the valley. So, but typically we'll go down there, back and forth to,
Well,
you know,
you're a short car trip away, and yeah,
right.
yeah, and obviously you're very concerned, and I certainly understand that. Is she happy?
She's doing great. Now, you
Mm.
know what? I think if anyone wants to know the secret to a long life, I think this is what it is. It's born optimism. I think that's it. Because it doesn't
Yeah.
matter every day. I mean, if she falls and hits her head like she did, oh, it might hurt a little bit, but I'll be okay. I mean, seriously, that's always the way she's been. And so she's really happy. And actually, at her age, 96, she does embroidery. She does word search puzzles, which I think she cheats with a lot, but still she does them. She was fun. And she does coloring in coloring books. So
Mm.
she, of all the people in this group home, I mean, she's definitely the one that's doing the most stuff. I mean, she keeps active that way.
She's really thriving. And that's wonderful to hear. Couldn't happen
Yeah,
to a nicer lady.
thank you. It was a difficult decision, and I'll just be brief. But once we only had her there briefly to make the move. That was the plan, and then we have a room for her in our house. But once I saw that, gosh, she's being around all these other people. They have a lot of activities that they do. They play bingo. They have art projects. They do all this stuff, and I thought that doesn't happen at my house. you know. So
Yeah.
actually, I recognized that it actually was a really good thing. So I feel good about where she's at.
Well, yeah, and I mean, obviously you were right because
Yeah.
she's thriving there, and relationships end up being the most important thing. And for people, she's always going to have her relationship with you and your husband, and you can love her from Payson. But the day-to-day stimulation just sounds wonderful, and that she's, I mean, to me, that's a no-brainer.
Yeah, yeah.
Everyone likes being right, and you were right. So,
Actually, it was not the way I planned it at all. It wasn't,
yeah,
it was just, happenstance that we just had
happy
this
accident.
meeting. Yeah, and then it was we were just so blessed to find this particular family and the group home they run, and I'm just so happy with them. So, we're very
Oh,
fortunate.
yeah. It's such a gift when you find someone you can trust with the things you love the most and the people you love the most. And that's really just so wonderful to hear.
Yeah, yeah,
I'd
we're
like
really
to
happy
look at
about
her CT with you, if that's okay. I think that's a really good kind of starting place
it.
to look at stuff. Is that okay? Okay, well, just for reference, can you see my cursor?
Yes.
So this is her nose
Okay.
and her ears.
Uh-huh.
And the middle of her brain is right here. This is a part called the brain stem. And
Okay.
as we go out to the right side, scans are portrayed backwards. This is actually the right side of her brain.
Okay.
This white area is the tumor.
Wow.
And you can see a couple things that are interesting about this tumor is that it is based on the surface of the skull, which is where the lining of the brain called the meninges are.
Mhm.
And that pattern of something that's based on the meninges and then grows outside of the brain and pushes the brain out of its way is typical of a kind of very common tumor called meningioma.
Mhm.
So that's why the doctor said, hey, we think it's a meningioma just based on its appearance.
Mhm.
There's some other things in this CT scan that are really worth noting, and one is the almost complete absence of atrophy. She's got
Wow.
her brain here is coming to the very front of the skull. There's no dark space there between the brain and the skull. And that here's an area where there's more fluid and an enlarged gyrus. So this would not be normal at 20, but it's very favorable at 96. She
Mm.
has very minimal atrophy of the brain, and
Wow.
certainly not any of the imaging features that one would say go with Alzheimer's disease or any other known dementia. So
Really?
that's just so fortunate and wonderful, and largely explains why she may cheat a little bit, but she can do those word puzzles
Right.
because of this. So that's really, really great. Another thing, it's a little more subtle, but see, if you look at this area here on the left side, this is the
Mhm.
normal appearance of the temporal lobe. And on a CT scan, that corresponds to the density of the brain there. And if we go over here, see how it's a little darker around this
Yeah.
area? Around the tumor is darker, and
Uh-huh.
it's darker because it's swollen. So this mass is not just sitting there. If this were a wart on her hand, it would just be sitting in
Mhm.
space and not pushing on anything. But this is a mass growing on the outside, pushing against the brain. And the brain
Mhm.
is telling us that it's reacting just a little bit. Not a
Mhm.
lot, not a lot, but just a little bit of swelling. So it's a tumor that is radiographically, the CT findings are strongly consistent with an extraaxial outside the brain type of tumor. And because it originates on the meninges, there's a very, very high probability that it is what they call a meningioma.
Mhm. Okay, I understand that.
Oma means growth, and meninge is the meninges, the lining of the brain. So it's a growth on the lining of the brain, meningioma.
Mhm.
All brain tumors basically have three options for treatment. Did
Mhm.
anyone go over these with you guys?
Not at all yet. No.
Okay, well, just so you can have them in your mind and get a sense of what to expect,
Mhm.
there are three options for the treatment of a brain tumor. One is to do nothing and watch it, but you don't do nothing. You put the patient in what's called radiographic surveillance.
Okay.
And we think of surveillance as two guys in a car eating fast food outside watching things. It's not that kind of surveillance. It's the surveillance where we're monitoring the progress of the tumor by getting CT scans or MRI scans. And in her case, CT is much easier to do than MRI at a fixed interval. And
Okay.
that could be every 3 months, every 6 months. If it's very stable, it could be a year.
Okay.
Option one, radiographic surveillance, see what it's doing. Option two is radiation therapy. And meningiomas are somewhat sensitive to radiation. Radiation is non-invasive. It can be applied from the outside of the brain. It
Mhm.
does reduce the growth rate of tumors in general,
Mhm.
and it might be able to sterilize or eliminate the growth rate of this tumor. It's a little tricky because typically doctors don't like to do radiation therapy without a tissue biopsy of the tumor.
Mm.
And the tissue biopsy is no small deal when you're 96.
Mhm.
However, the imaging features this thing, it sure does look like a meningioma. My guess is we could find a radiation oncologist. That's the
Mhm.
kind of doctor that does this radiation treatment who would
Mhm.
treat her without a biopsy.
Okay.
And then the third option is surgery. And surgery is where you go in and do a craniotomy. You expose the outside of the brain and remove the tumor. And surgery is, this is a tumor that's likely curable with surgery, but you have to go through the surgery, which
Mhm.
would mean anesthesia, opening the brain. Very, very, very high risk in a 96-year-old.
Yeah.
So, I mean, on the surface of it, when you look at those three options, radiographic surveillance, radiation therapy, or surgery, I think you could just take surgery off the table. I don't
Mhm.
think the risks are worth the benefits.
Mhm.
So
Mhm.
then you get to, okay, would it be best to do radiation or would it be best to do the radiographic surveillance? And that decision is largely based on the risk of the tumor. Meningiomas tend to be very slow growing tumors that don't cause much trouble. Now, one thing they can cause is seizures.
Mm.
And one thing she may have had on the toilet was a seizure.
Mm.
She passed out and fell. It's quite possible that she had a seizure and fell. But
Wow.
frankly, it's
Mhm.
not that likely. It is in a part of the brain called the temporal lobe, which can lead to grand mal convulsive seizures, but she never had any convulsions or anything like that.
Mm-mm. Never.
So it's not specific, but it's suggestive that it was not a seizure. And that means
Mhm.
she may
Mhm.
have, it's much more likely that the passing out on the toilet was due to being on the toilet, which is called micturition syncope. Some people faint when they pee because of the effect of their vagal nerve.
Mm.
It could be that she was dehydrated and that she just had, it could be that she had a heart issue.
Mhm. Mhm.
All of those things taken together make me think, hey, just because you have ticks doesn't mean you don't have fleas,
Mhm.
right?
Mhm.
Just because she has this slow growing meningioma doesn't
Mhm.
mean she didn't pass out because of her heart. So it's definitely worth it having the doctor evaluate her from her heart point of view, do an
Okay.
electrocardiogram, and see what that shows.
Okay.
Another option, an electrocardiogram measures the electrical activity of the heart,
Mhm.
and EEG, electroencephalogram, measures the electrical activity of the brain.
Mm.
And one option here, if we're concerned about seizures, would be to get an EEG of the brain. It's non-invasive, and it would say whether this tumor might be causing abnormal electrical activity. The reason you would want to know that is she could just be placed on a anti-seizure medicine, and that might eliminate the risk of further episodes of passing out.
Mm. Interesting.
So a lot of I think your loving daughter, the good care that you want to give your mother at this point to me would be definitely radiographic surveillance,
Mhm,
definitely evaluation of her heart.
mhm,
And then if it turns out that the heart is normal and there's more of these fainting episodes, then I would favor an EEG.
okay,
And if the EEG were positive, she could go on medicine to prevent seizures. That would be managed by a neurologist doctor. If the EEG were negative, that would be a pretty strong indication it's not the tumor. And then in the meantime, if the radiographic surveillance, if this thing is getting bigger, we assume they're slow growing tumors, but not always. If it
mhm,
were growing, that would tip us over to pursue radiation treatment without, we would try to find an oncologist who would do radiation treatment without a biopsy.
mhm.
Does that
What
make
kind
sense?
what kind of, side effects from the radiation treatment would she suffer or whatever?
That's a great question. The most common side effect is fatigue, which we don't need at 96.
Right.
It makes you very tired. Another common side effect is seizures, which we also don't need. And then the last thing would be inadvertent damage to the brain
Mm,
around the tumor, which is very unlikely given the very favorable, this thing's right there. It's right
mhm,
on the surface. It's very easy to reach and radiate.
mhm,
So the probability of complications is low, but it's not zero.
mhm.
And I mean, to me, anybody over 90 is a very fragile ship, and you don't want to rock that boat.
Right, right, right.
So the best thing to do, we always have a very high threshold for any kind of intervention in the brain, and that threshold's even
Mhm,
higher when you're 96 than when you're 56. So,
mhm, right. Yeah, makes perfect sense.
okay.
Okay, all right. So, totally understood. So thank you for that. That's really helpful to make it really clear on where we need to go and what steps we need to take.
Oh, you're welcome. Um, I I feel very fortunate to be part of this conversation today because taking care of our parents is just nothing but an act of love. And it tends to be, I know her, it's what comes around goes around. And what a joy to have this very happy and pleasant and engaged lady in our lives, and we want to keep her there, but we don't want to do anything that rocks the boat and hurts her either. So
Ab-
I would feel comfortable if I were her son
mhm.
with radiographic surveillance, a cardiac evaluation, and then careful, watchful waiting and see what
Okay.
happens.
All right. Well, thank you so much. That's so appreciated. And we're going to take it to heart and follow those directions specifically.
Okay.
All
Well,
right.
I'm here. I'm an ally. If there's anything, I'm not a doctor. I'm not practicing anymore. But if I can help in any way, I would love to. So let me know what happens and give her a big hug and a big kiss on the cheek for her ex-doctor.
I will. Thank you so much, Dr. Lieberman.
You're welcome. Have a great day.
Thank you. You as well.
Bye-bye.
Take care. Bye bye.